Cork Today on C103.
And let's head to the Health Hub in Ballincollig and join Annalisa Drizzell, as we usually do every Monday. Good afternoon to you, Annalisa.
Good afternoon, John Paul.
And your nutritional questions are welcome on text or WhatsApp. And a number of them in, and I think, Annalisa, you'll be very aware of this, I'm sure, from people going into your store there in Ballincollig. This is from Patricia in Ringaskiddy. She has a bad cough at the moment. It is worse at night. It cleared up for a while, but it has come back. So what would you recommend? And it is hard to get any sleep. Now, she's not on any medication whatsoever, but from other callers that have rang up and texted in today, it's when they lie down, it seems to get worse.
Okay. Yeah, well, I think that there is a lot of COVID around at the moment. There was a big winter flu this summer as well. So I wonder, the first thing I would suppose is just to check that it isn't COVID and that it is just maybe a cough. And then I'm not sure if it's a dry cough or if it's a mucus-producing cough. If it's a dry and tickly cough, what you want is something that nourishes the mucous membranes at the back of the throat. And you're looking for something like with mullein or marshmallow in there. The ones that we find work very well for people are the Irish Botanica botanical syrup, the Comvita Manuka honey immune support, or else we have mullein syrup as well, which is very, very good at soothing for dry and tickly. One that you'll probably get in any health store is called Bronco San by A. Vogel, and that's from kind of Norway spruce, and again, good for dry and tickly. If it's gone into your chest and if there's a lot of mucus coming, you're still struggling with that virus. So something like the Dr. Delish Care Mucotone would work very well because it's a blend of herbs to kind of help clear the chest, dry up the mucus and support the immune system against the virus. So that's a great one. And we have another product here by a company called Betula called Pectus, Pectus, which is a kind of a combination of different things for kind of the chest and the cough. So any of those would do, I think. Generally, coughs and anything inflammatory is worse at night. John Paul, most people will notice if they get asthma attacks, it can be worse at night. If they're in bed with arthritic pain, it can get worse at night. So that can often be the reason why a cough is worse at night. But if you notice that you're coughing all year round when you lie down, it may actually be a little weak valve at the top of your stomach, allowing fumes from the stomach acid to escape up, and that's catching your breath and causing you to cough. So if that has been a situation for you in the past, taking care of that is the important thing. And what we normally recommend is a combination of slippery elm and zinc carnosine to help tighten up that little valve, and that generally works for most people.
Hopefully that works for a lot of people who have been in touch with that cough going around at the moment. And Elizabeth and Elisa has got cellulitis after a bite on her leg. Now, it seems to have come after the bite. She wants to know, is there anything she can take to prevent this from happening again?
So, that's a difficult one in a way, but John Paul, because cellulitis is where the bacteria that often maybe just actually exists on your skin gets into your blood and actually starts to cause blood poisoning. So if you get a bite and you notice that the redness is starting to travel up the arm, the leg, the limb, that is a very high indication that that's what's happening. And you need to have high-strength antibiotics to get rid of that. So if you're prone to it, the first thing I'd recommend is that you just keep an eye on it and maybe have antibiotics at the ready, because if it goes too far, blood poisoning can actually be quite dangerous. In terms of prevention, certainly after the antibiotic, I would take a good probiotic to kind of populate the gut and the skin ultimately with healthy bacteria. And healthy bacteria tend to help keep the skin healthy as well. Immune support is very important because cellulitis often happens in people who are immunocompromised. So make sure that you're taking at the very least, your vitamin D, your zinc, and your vitamin C throughout the winter months. And then it's about preventing yourself from getting bitten if you think that it started off by bites. So rubbing something like citronella or peppermint oil into your sun cream or body lotion and rubbing it onto your legs will help to prevent you getting bitten in the first place.
And Mary is in Middleton. It's like what Patricia's question was earlier, but a bit different because Mary suffers from a dry mouth and nose for the last number of months. She wants to know what could be causing this. Now, she is on medication. She's on Kintira patches and stink-knocked sleeping pills. So what would you recommend for Mary in Middleton?
So I think it's definitely a side effect of the medication, probably the sleeping tablet at night. I think that would be a fairly common and known side effect. So unfortunately, there really is it's very hard to battle the side effect of a medication. I think the best thing to do is to keep your mouth hydrated. Maybe get a little spray bottle, and into that spray bottle put in maybe something like you need to use sterilised water, but you could maybe put in some mouth healthy drops, like maybe eucalyptus or peppermint, that will keep the mouth nice and healthy. The other thing you can take as well, for anything dry, like in terms of membrane, so dry eye, dry nose, dry mouth, the omega-7 fats are very, very good for that. And you can get those in sea buckthorn. You can buy it in any health shop. And I think you'll probably get some relief if it's as a result of your medication, but you'll need to take them all the time because it's the medication causing the problem.
Okay, hopefully that helps you out, Mary. And another Mary, and this Mary wants to ask you what's the best vitamin D product to take, because she has been on, I think it's Humira, for 10 weeks for rheumatoid arthritis, but has been told that her vitamin D levels are quite low.
Yes, and I would suggest that anybody who's got an autoimmune disease of any kind, be it lupus or rheumatoid arthritis or Hashimoto's thyroiditis or ankylosing spondylitis, any of those, and ulcerative colitis, Crohn's disease, you should be getting your vitamin D levels checked on a regular basis, because studies have shown that vitamin D levels tend to be compromised in these individuals. So I would suggest that you take a minimum of 1,000 units a day of vitamin D, and it needs to be vitamin D3. Now, they come in different forms. You can get them in tablets, you can get them in soft gel capsules, you can get them in cellulose capsules, you can get them in sprays. I think the ones that are probably in a bit of fat are quite good. So I personally like the soft gel capsules because vitamin D being fat soluble, I just think it optimizes the ability for the body to be able to absorb it. So the brands that would be very good generally would be Nature's Plus. Viridian is very good. The Nature's Plus one, they do the soft gels. Pharma Nord do soft gels as well. They're called Bioactive D Pearls. They're an excellent product. So just make sure that you're taking a reasonably good quality one from a health shop. And if you're taking 1,000 IUs, that's probably enough to cover healthy people. But I think it should be that you should go and get your D levels tested if you've got any type of autoimmune, and then base your daily intake from then. So if it's really, really low after the summer, if your vitamin D is very low after the summer months, you'll probably need to take maybe 2,000 rather than 1,000 a day.
And Kath has a situation where she's feeling very tired, Annalisa, and bloated. She has that tired, bloated feeling nearly all the time. And she says even though if she goes to the toilet for number 2, maybe after breakfast, it still remains with her, that tiredness and bloated feeling. Anything that she can do, or what can you recommend for Kath?
So it's a difficult one, because tiredness can be as a result of lots of different things. And then bloating can be as a result of lots of different things. And while bloating might make you feel tired, it's not necessarily always the case. So I don't know, has there been an antibiotic in the past there recently? Is there, if you evacuate your bowels fully, you probably shouldn't be suffering from bloating. You shouldn't have that bloated feeling unless there's a build-up of gas. It's possible you're not digesting your food properly. So maybe for the bloating, you could try a digestive enzyme. And I'd recommend one with a probiotic, because sometimes if you don't have the right bacteria in there, the other bacteria can ferment or putrefy foods and cause bloating and wind and things like that. So I know that Terra Nova do a lovely product that has a digestive enzyme and a probiotic combined. And also there's a Patrick product called... I think it's called Digest Aid, and that one is Digest Pro it's called, and that one's a combination of a few different things. So I'd suggest trying that for the bloating, and maybe if it increases the energy, it might mean that if you're digesting your food, you're getting the good out of it, may improve your energy. But if you don't feel an improvement in energy, other causes could be low iron, low vitamin B12 or folate in the blood, that are low vitamin D. So a blood test would show all of those up. Sometimes it could be post-viral fatigue. I'd recommend NAC for that. N-acetylcysteine or NAC is very good for that. and coenzyme Q10, that can help with energy. Sometimes just taking a B vitamin supplement can help boost your energy. And then for an immediate energy boost, ginseng is great because it doesn't make you feel jittery, but it will give you a good energy boost.
And as you're mentioning energy boost there, maybe those you've mentioned can work for Mike. Mike is a new dad. His baby is only about 3 months old, but baby isn't sleeping very well. So as Mike is going to work, he hasn't a lot of sleep and he wants to know what can you recommend to boost his energy so he can stay concentrated in his workplace.
I think definitely I would probably recommend 2 things here, John Paul. I'd recommend a tonic on the whole, because when you're tired like that, you actually have a higher nutrient requirement a lot of the time, because a lot of stuff happens at night time in the body in terms of repair and rest and maintenance that's not happening if you've got interrupted sleep. So I'd recommend a good tonic like Source of Life Gold. That contains an awful lot of stuff besides the basic vitamins and minerals for the immune system and for energy support. And there is a little bit of ginseng in that. So if that's not enough to keep you going, then just get a bottle of ginseng. One of my favourite ones, again, it's a Terra Nova product. It's called Dynamic Synergy. And they have a Vital Synergy one. They have about 5 different ones of blends of ginsengs with other herbs that support you through stressful times, be it physical or mental stress or lack of sleep stress. And they're great to take mid-afternoon just to maybe get you through the afternoon and help they'll all improve concentration as well.
And any advice for Mary in the city? Mary is feeling depressed and down at the moment. There's a lot of sickness in her family and a few other issues. Now, she has support around her, but she wants to know, could you recommend a natural remedy for depression?
Well, I suppose the most typical one, John Paul, is St. John's wort, which unfortunately is only available on prescription from the doctor. But in this case, I think rather than it being a classical clinical depression, it's more of a situational depression, probably because of long-term stress with all of the stuff that's happening in the family. So I think if you support the body here for the stress, and this happens to people who are grieving as well, grief is a huge mental stress, and then it puts a physical toll on the body. I think that supporting the body for stress will help lift the mood naturally. So there's a couple of things I'd recommend. The first is something like ashwagandha. It's a great herb for kind of improving your core strength in terms of coping with stress. So it's a great one for anybody who would have busy jobs, busy lives, would feel that stress is getting on top of them, who do an awful lot of physical activity as well and sports. It works very well for them. For people who've been mentally stressed, if you're going through breakups or a loss of any kind, it's one of the best ones I've ever seen in the shop for really just helping people improve their coping skills. So we have a couple of ones that we really like. There's a Stress Vita one that's a great quality one. But if you go into any health shop, they'll have a whole variety of them. And then in terms of low mood, there's saffron has had some fantastic benefits, and there's some lovely, interesting studies on it. So there's a couple of products that have saffron in there. Solgar do one called Ultimate Calm, and that has got saffron in there. I think it's mixed actually with a bit of ashwagandha, so that's a perfect one. And then Viridian also do one with saffron in there. And then the last product I recommend, because I've seen such good results in the shop here, is Nutri Advanced Resilience. And they'll all help. They can all work together and they'll all help.
Okay, Mary, hopefully that helps you out and you mind yourself. And Annalisa, thank you for that. And we will chat to you next Monday once again.
Thanks, John Paul.
Take care. Annalisa Giselle there joining us from the Health Hub in Ballincollig. You can check out everything she said at her website, healthhubstore.com.